Welcome to episode 2 of the Princeton podcast with Mayor Mark Freda. In this episode, Mark sat down with Jeff Grosser, Princeton's Municipal Health Officer, to discuss the current state of affairs regarding COVID-19 issues and events here in Princeton. They also discussed Jeff's background, his daily health department duties, and the impact of COVID-19 on Princeton's public school activities. So without further introduction, let's join our host, Mark Freda, and his guest, Jeff Grosser, for episode 2 of the Princeton podcast.
Welcome, Jeff Grosser.
Thank you.
I guess people might wonder, what do you actually do every day? What does a health officer do?
And some jobs might be like this, and I don't know if this is cliche, but the best part about what I do every day is that every day is different. And every day is a different need for the community. And that sounds ambiguous because public health can be ambiguous. Obviously, our job right now with the pandemic is to identify new cases, contain any exposures, contact trace via, individuals that we identify as contacts and exposure points, and then try to suppress the disease. That's the piece of public health I think people kind of know about at this point. Prior to the pandemic, most individuals would say, oh, well, the health department inspects the restaurants. Yes, we inspect the restaurants. We have inspectors that inspect the restaurants to make sure the food is safe and everything is where it needs to be from a sanitary perspective. But we had always performed communicable disease investigations. Before the pandemic, we would have cases of measles and mumps and vaccine breakthrough. It happened. And we have a team of communicable disease investigators, or public health nurses, we call them, that investigate the disease. As the health officer, my job is to essentially be the coach, and I organize the efforts of the health department. We have health educators that educate the community on different benefits of their health if they know certain things, just like teachers. We have a vital statistics department that is responsible for birth, death, and marriage certificates. That's where all those fun documents come from. Princeton has a storied public health department with the oldest board of health, one of the oldest board of healths in the state, that was created in 1880. So it's just got a robust history. And as the health officer, I'm proud that we have a great team there. So I essentially lead that team for all efforts public health coming out of the town.
Yeah, it's actually quite a bit. So it's nice to actually hear all that's involved in that.
And sometimes I probably forgot a few things. We also investigate complaints, poison ivy, high grass, trash complaints, odors, things like that. We try to be the department that when complaints don't have a home, we try to take them in and then handle them. Because as we're beginning to all be aware, everything comes back to public health.
Yeah. So I guess the one thing that obviously is on everyone's mind a lot these days is COVID. The Delta variant has come out. Things have changed as far as what's going on. So what trends do you see happening now, and where do you think we're headed now? We're getting towards the end of September, middle of September, end of September. Where do you think we're going over the next month or so? Any kind of predictions or thoughts on?
Yeah, so as a health officer, we do a lot of forecasting and predicting, and we try to follow, similar to other positions, you try to follow the experts in the field and what they're saying. The scary part is that we just don't know. We don't know in terms of what other variants might arise. The good news is we have a pretty sophisticated surveillance system to identify new variants now, but we certainly know right now Delta is making up pretty much every case that we see, over 99% in New Jersey right now. Just 2-3 months ago, and you're aware of this too, Mayor, is that we were in a place where we were seeing no new cases. Our 7-day and 14-day moving average were basically bottomed out. Alpha variant, we determined we've kind of figured out how to handle it, how to avoid transmission. The vaccines were, at that time, everybody felt like they were so effective that we could move on as we know it. So what's changed? Well, it changed quickly is how quickly a variant can spread amongst the community. But what we do know, and we're learning more about, is vaccine effectiveness does not mean, when we have vaccine breakthrough cases, it does not mean the vaccine's not working. It just means that individuals are becoming infected due to some other variable. Viruses burn through communities. They burn through populations the way they want to. And there's not always a way to predict that. What you can do is without having the virus burn through places, you have to make sure that whoever's susceptible is protected. And, we've heard a lot about things like herd immunity, where you get the population vaccinated or protected, and there you go. We hear a lot about the 1918 flu pandemic, where once the virus went through the population and there was no one else left to infect, eventually, the virus will stop infecting people. With COVID, I think what we're going to learn is that we're going to start identifying, as we've spoken about a little bit, through different forums, we're going to start to identify the risks that we're willing to take. And if we get to a point where individuals are protected in a way where we're not going to see those severe cases of COVID, that'll be probably those first major steps back to some sense of normalcy. It's not a bad thing that people have learned how to, contain disease. It's a good thing. The bad thing is that we need to get to that point in a civilized fashion where there's less concern over, is this misinformation or not? We need to make sure, do we actually know what's happening? And I think with the vaccines, the more we know about what's happening with them, especially with the booster shots coming up, that are supposed to be live September 20th, we're all learning as this process moves on. And I think at this point, what we can say about Delta is we are starting to see a plateau in other parts of the country. And through this pandemic, we've seen Princeton, for some reason, we lag a little bit when it comes to these trends that are happening. And right now, we're kind of at the tail end of that. And we are starting to see a minor plateauing. So I'm hoping that that's going to continue. The best thing we can do is continue to evaluate and provide surveillance on other new variants that are coming up, and making sure that the resources, the necessary resources, are still being provided to public health. Once this is all said and done, we don't forget about everything that's happened in the last 2 years, but we remember how to stay prepared and where we got to and how we got out of this thing. So that's the best way to stay prepared moving ahead.
Looking at the reports, which are excellent, I might add, that you put out regularly to the governing body and that we put in the newsletters we send to everyone throughout the town, it seems the vaccination rates for Princeton residents are really high. Is that accurate?
Yeah, Princeton residents through this pandemic, I have to really take my hat off to them. Between their emails of support to their interpretation of guidance that actually will help us, provide more protective layers for the community. We look at guidance twice. It doesn't matter if it's from the CDC or the Department of Health. We have experts in this community that speak on a lot of these subject matters. So we utilize their guidance and their input that we receive whenever we look at new guidance and whenever we think about new protocols for the town. But yeah, as a whole, you're right, Mary. The vaccination rate for Princeton has been pretty stellar. The 65 and older population, we're almost at 100%. Our 18 and over population, we're just above 80% right now. So that last 20%, we're still in the community trying to get out to them. A lot of the convincing of that 20% is coming from friends and family. We do our best to educate, but at the end of the day, they're going to determine when the right time for them is to get a vaccine, typically from a loved one that is, maybe either susceptible to it or just gets through to them one day. But nonetheless, we're trying to stay present in the community. So when people are ready, they have it. And, as you mentioned, we're still continuing on with the booster and the third dose conversation and being prepared for that next week.
So another question I think a lot of people will be interested in is, how is this school year different for students and families versus this time last year? Yeah,
this has been a tremendously difficult week of school starting since school started last week. And I have a lot of empathy for parents and grandparents of young kids that are concerned and scared because the last population here that we're looking to get vaccinated once the vaccine's approved is going to be this 0 to really 11-year-old range, which are really our elementary school age children. And we know they're susceptible to so many other health outcomes that this is a concern. And parents, I think, and myself included as a parent, you feel guilty that you've gotten the vaccine and they haven't yet, and that schools are back in person. So there's a lot of concerns there, and we've been hearing those concerns from the community. Princeton Public School District, our private schools, charter school, have done a remarkable job seeing where we were in June and July with very few cases in the community to this surge of Delta cases in August, where they've pivoted so quickly to change guidance to be more rigorous to start school just 4 or 5 weeks later. And I think it's important to note, the guidance changes, but it's like a locomotive. Like, it takes a while to get that guidance changed because you have to look at the science and determine how is this going to be applied in a real world setting. Applying protocols within a K-12 school is not an easy feat. So if you change seating charts, requirements of the school day, lunch outside, masks mandatory, no mask breaks inside, snacks have to be outside, extracurriculars are going to require testing. These are huge things that school administrators have to do. And, school administrators are amazing civic employees, but they're not public health experts. So to also deploy these things, they are really reliant on the medical professionals around us, the Board of Health, the Board of Education, the health department. So we've done our best to really try to support the schools. The New Jersey Department of Health recently has announced a $260 million funding source for screening testing for schools, K-12 schools, particularly for unvaccinated. So our elementary schools, some middle schools, high schools that they have unvaccinated students, and then obviously the staff that haven't been vaccinated yet. This will be a game changer with regards to disease transmission, because we'll be able to identify cases within the schools quickly versus just waiting for positive results as a matter of symptoms. Back to your question, I think we are in for some tough weeks ahead with schools and identification of new cases and trying not to disrupt the school year like it was done last year, while keeping the kids safe. And I think with the 5 to 11-year-old vaccine approval on the horizon, hopefully mid-fall, I think we're getting close to a point where some of those concerns are going to be brought back to a better sense of reality.
Good to hear. How have the roles of the local health departments shifted during the pandemic? And, what happens after COVID? What changes are going to still be here or whatever?
So since Princeton's first case back in March of 2020, it's really been all hands on deck towards the pandemic response. We had a minor break in the summertime where we got back to, youth camp inspections and restaurant inspections on the regular occurrence. We're still inspecting restaurants, of course, but every employee has been asked to contribute somewhat to the pandemic response, and even staff outside of our department. The pandemic's changed the responsibilities of staff, where staff that were normally just used to, performing restaurant inspections or used to, giving out birth certificates, now they're answering calls from concerned residents about COVID protocols and how they're interpreting them, and going out to COVID vaccine clinics and providing, consent forms so we can get people enrolled and vaccinated. So it's really been all hands on deck. And again, the staff in Princeton at the health department are tremendous assets to the community. They love what they do, and they'll do anything for the town. And that's the part as the health officer, as the leader over there, drives me, because I see some of the things that people are willing to do outside of their comfort zone. And it gives me the motivation to step outside of my comfort zone with some of these things. And I know that at the end of the day, if any of us, as we've experienced, if any of us get ill, somebody else is there to fill in the void and help out. But the support within the department has been tremendous through the pandemic. And I expect it to continue after the pandemic. Post-pandemic, I expect changes in public health. There's no doubt. It's going to have to change. And by change I mean the system of public health. We are a local public health department by all senses of the word. We have approximately 9 full-time employees. Prior to the pandemic, we had 4. We've been fortunate to get resources as a measure of support from both yourself, Mayor, and Council, supporting, full-time position acquisition of a full-time nurse. And then obviously the taking on of grant funding sources from the State Health Department and the CDC for other positions that are super needed in all communities. We were able to hire a vulnerable population outreach coordinator, a COVID generalist to assist us with the clinics, and those positions have been vital for our response. So after the pandemic, I think what's going to be a major focus of the department, is to make sure that we stay relevant when it comes to the needs that we have to make sure that the community stays safe and stays prepared for whatever has to come next.
One thing I've noticed over a period of time is the partnerships that the health department has had with the county, with Princeton University, with local businesses. I mean, you've been doing clinics all over town at all different times. Maybe you could, share with our listeners all the different opportunities you've taken advantage of to get out there and give people shots.
Yeah, I mean, public health, from a definition standpoint, I went to an institute called the Northeast Public Health Leadership Institute through the University of Albany. And Dwight Williams is their founder or one of their directors. And he starts off the institute that takes place up in Rensselaerville, New York. And he starts off the institute saying public health and leadership are relationships. And I've never forgotten that. They really are relationships. You don't always have great relationships, but you have to forge them. And we have a Board of Health Vice Chair, Dr. Fernando, who's been instrumental through this pandemic response. And he's always told me, you can't forge relationships in the middle of a disaster. So I try to combine those two quotes from those gentlemen, and I try to blend them a little bit, because I actually disagree a little bit with Dr. Fernando, because sometimes actually disasters bring together relationships that would have never been forged before. But I don't know if that's really what he meant. I think what he means is you can't prepare to have a relationship to support one another in a pandemic, because everybody's looking out for an emergency, because everybody's looking out for your entity, right? Your own self. Why we're so fortunate at the health department is our job is to serve everybody. So if you work here, you live here, you run here, you go to school here, we serve you. So we don't care. We'll serve everybody. We've had some tremendous partnerships through this pandemic. And that's another thing, back to your other question. That's something that we're going to have to make sure doesn't go away, because once those partnerships really started to click, it was difficult to get in our way. The Princeton Senior Resource Center was a fantastic partner to us. I'll speak about them just because they offered up, their primary facility, which is at the Suzanne Patterson building right behind Monument Hall. And we utilized that facility to vaccinate over 1,000 people. They opened their doors to us. They offered staff. They offered translators. They also did vaccine navigator programs via phone. So they really pushed everything that we needed from a facility perspective and a person perspective for help. But I'd probably be remiss to mention that the school district actually also offered their nurses to perform contact tracing, because they have knowledge, obviously, of clinical aspects of the disease, and they have already done this with their school. So they opened their workforce for us too. But even in the early days of the pandemic, when we first started contact tracing, our first outbreak in March 2020, the police department gave us their detectives. They offered their detectives to perform contact tracing. So we gave them a list of questions, and we had them start calling these 70 or 80 people that we had potentially linked back to one event. So it's a little bit of a combination of not being afraid to ask for help. I've noticed that people they enjoy helping each other for the most part. And in Princeton, I think it's like tenfold. People want to give their own time. And we see that with a lot of even our boards, commissions, and committees. Individuals offer up their expertise and time, usually without hesitation. And in the pandemic, because so many people were working from home and their daily work life was disrupted and they had a lot of extra time on their hands, they were offering themselves up, their organizations up to help us out. And it's one of those things where you can't be too proud to ask for help, but at the same time, you have to also be able to determine where that help is going to be best suited, and not be too concerned over if somebody thinks you should be doing something differently. Try to accept it in a constructive manner, even if it doesn't come in like that. That is something that I'll probably take with me after the pandemic, because prior to that, there was always a level of competitiveness on my end where I would feel like, well, we should be prepared for this. You're not always going to be prepared. You have to accept help, especially in times you really need it.
Right. And I think we could point out the university has helped with clinics. you worked with small businesses on parts of Witherspoon Street. You've had clinics at all strange times of the day and night. I mean, I think people would love to hear about some of those efforts.
Again, let me preface this, and I apologize. There are so many partners that I don't have a piece of paper under me, in front of me, and sometimes I'm bad at recollecting every single moment of the pandemic, which I don't know if that's on purpose or not. But yeah, absolutely. I mean, Princeton University has offered up, Jadwin Gymnasium. I mean, what a fantastic, probably the nicest venue for a vaccination clinic outside of, MetLife Stadium or something like that. I mean, it's just tremendous. Their staff, they've got just a robust health services department, doctors, nurses that would offer their expertise and guidance. The businesses and the Princeton business community through this whole thing has been nothing but helpful. They've been managing and providing organization to get their staff vaccinated and have been supportive over that. They've been present with offering up locations. La Mexicana on Witherspoon Street has offered up their location as a vaccination spot. It's actually one of our more productive spots in the community where we've just had vaccination clinics that you would think are, block parties. I mean, and I mean that in a really good way, bringing the community together. And I think what that also opens up is just how much residents trust certain business owners in the community. And utilizing that resource was something that we didn't see coming prior to the pandemic, was just the way into the workforce was through these just, loving, caring owners of businesses that treat their employees like families. Princeton Merchants Association have been, they've been inviting us to their meetings throughout the pandemic to just provide a forum to update businesses, because otherwise we'd be reaching out on our own to all these independent groups. So, obviously them as well. And there are other people that I know I'm going to forget in organizations. So again, no disrespect there. I'll have to say all encompassing, Princeton has been so supportive through this and the pandemic. And I expect them to continue to be so, because we're going to need them, hopefully through this last leg of this.
Yeah. It is great to hear how so many different individuals and businesses and groups came together during this and continue to come together. But let's shift a little bit. What public health challenges exist in Princeton versus other towns in New Jersey?
So as you mentioned, Mayor, the university is just a tremendous resource, but it also provides challenges, and good challenges, exciting challenges within the field of public health. They have students and professors that will travel to all ends of the earth. So we call that travel medicine. And sometimes there's concerns over exposures in those ends of the earth when they come back to Princeton. So, you always have travel medicine and, as we would call them, international diseases that we were concerned about that in other places you wouldn't necessarily even worry about. So there are diseases and reportable diseases that we might have to keep on our radar, where other health departments don't necessarily have to worry about that as much. As we mentioned earlier with schools, we have a number of private schools. Some are, they have students living on campus, so they also contribute to other concerns where they're almost mini colleges. So Princeton has a number of, from an educational perspective, a wide array of these educational settings that definitely provide a different type of challenge when it comes to different type of disease intervention, especially communicable disease intervention. There's also a lot of transient population. We have a lot of people that come into Princeton to work. And when you have people working here but not living here, that raises a concern for us for one main reason. Reportable diseases that, like COVID-19, are linked to your jurisdiction to where you live. So back to your business discussion, we rely heavily on these businesses that if they know something about a staff member, it really helps us to identify future disease outbreaks when we know of staff that are positive with something in particular. You do rely on those other health departments where those individuals live to perform contact tracing, and they ask occupationally, where do you work? You'll get notified by those health departments so you can keep an eye on that particular establishment or reach out to them to see what's going on. But Princeton just has a lot of individuals that are very, very active from, like I said, an occupational perspective. And when you have that, you have a lot of opportunity to bring disease in and out of the community. So we try to stay ready for that. And it's another reason why our communicable disease portion of the health department is typically pretty busy on any given day with just new updates and things we have to look into. Other challenges that exist in Princeton is that, between the educational facilities and the business facilities, we have a number of animal life and wildlife concerns that maybe some other towns don't worry about. Princeton is very much in my book, even though it's somewhat suburban, it's pretty rural in sections. So we hear of a lot of different types of wildlife concerns and things like that exist with rabies and different types of zoonotic illnesses that we don't always really broadcast because they're they're kind of concentrated in certain areas of town. But we do let different communities know when there's different rabies outbreaks and positive cases, so we can make sure that the right information gets out to where it needs to get to. But ultimately, what's great about Princeton is that with all of those challenges come, a lot of well-versed experts in the field, like I mentioned earlier, that are willing to give up their time and their expertise to try to help you. So when you have those kind of different situations arise, they're willing to be there to help out and guide you through them.
It is amazing all that your world encompasses and everything that you see. But so with all the different things that happen, is there some favorite part? Is there something that's, every day you say, oh, good, I get to do this? Or
it's got to be, yeah. Well, I do. Outside of the team that we have at the health department, working with that team, which is really just, it's awesome to be part of something that you're putting effort into something that's so much larger than all of us, and you're making an impact because you're part of a team that all has a shared vision. That from a professional perspective. But it does come down to really one of the main reasons why I fell in love with public service, which is helping people. We have opportunities every day to help residents and help them a lot. There are instances where we might be dealing with the childhood lead poisoning situation, and doctor diagnoses the child. The case gets turned over to us, and our job is to find the lead and get it out of the house. And that's our calling. And we go in there and we find it, we get it abated, and the child can go on and live in a safe place. And there are situations like that where you're making a major impact in that child's life. Now, what I'd like to see is hopefully more attention to prevention, where that child's not poisoned in the first place. And we could have more surveillance and better monitoring in locations where we know there's older housing stock or different things like that, and we can make a dent before there's a problem. That's always the goal of prevention, but it's not always easy to sell that because prevention does cost money, and resources are limited. So we have to advocate for where we can, make the biggest impact. But ultimately, I love improving people's lives especially from a health perspective. And when people recognize that, it's fulfilling and it makes working here all the while. But the departments here within the municipality, the municipal government here is very much run like at times, I'm sure, it could probably be argued, but from my perspective, from my vantage point, like a very well-run business. And the departments around the health department, in their departments, their staff, very much are experts in their field. And it's fun to work with those departments on shared visions, different projects to improve the community. That is just, to me, it doesn't feel like work. And when it doesn't feel like work, you're enjoying it.
That's great to hear. So Jeff, why don't you tell us a little bit about yourself, your background, and what led you to become a health officer?
Sure. So my background in public health started most likely from just my interest in science and math, and in liking those subject matters. You typically look into the biology, the sciences, different types of math, and in looking for where I was going to prosper from a professional perspective, and reviewing different colleges and universities. Some of those schools included schools that had medical campuses, medical schools that were attached to them. Growing up, I always played soccer, pretty religiously. I played soccer through college. I ended up going to college for that. So I was always into fitness and health. So I kind of try to tie those things together. And combined with that, my dad was a research engineer working with various types of petroleums, lubricants for a corporation that had a lot to do with health and safety. And he would always talk to me about, protecting yourself from different chemicals and things like that. And it sounds kind of odd as a kid growing up talking to your parents about chemicals, but he did work pretty extensively on some of these types of technologies. When I probably put all those things together in high school, I started to do the college search, and I wanted to go to a school and play soccer, but I wanted to go somewhere that I knew that if something were to happen to me from a injury perspective, I'd still be happy with that school. So during the college search, I came across Johns Hopkins University, which has a good medical school, I'd say, and I wanted to open my horizons to see, what would I really be interested in? At this point, I really wasn't certain if it was public health or not. And in making an official visit with my father down there, came across the School of Public Health, which is actually on the medical campus at Hopkins. And just fell in love with the school, the history. Obviously, I could still play soccer there and start, which was good. And went to school there. And just the best part about Hopkins is you're learning from professors that are world-renowned experts. So to develop a passion in public health was a given for the most part. And that's even coming from a student athlete that probably could have given a little bit more time in the library, and off the field. Nonetheless, went through 4 years there, really got into population health and working to improve populations versus just single people like a doctor would look into perhaps. And as I was wrapping up my undergraduate career, it was right around the recession, 06, 07, and the job market was absolutely not in good shape. And for public health at that time, we know public health is one of those things we don't always think about when it's happening and things are good. If we think about life pre-pandemic, prevention health doesn't always get the bucks, right? So I got an offer from the head coach of the soccer team that he wanted to keep me on as a grad assistant. And I went ahead and I applied to enter the School of Public Health at Johns Hopkins University, which I was accepted into. And I entered into the environmental health sciences division of the School of Public Health. My interest there again was kind of spurred back to my childhood and just hearing about how the environment can impact you. And even from like an occupational perspective at this time, I was pretty interested in how organizations put so much effort, especially large corporations, so much effort and time into protecting their workers from the things around them. And I guess also on top of that, I was a pretty avid fisherman, and I was always not impressed, but I guess almost disappointed in some of the negative things you would see, even if you're 80, 90 miles off the coast with regards to how we've impacted our environment in the oceans. And I always felt somewhat responsible for that, and I wanted to help. So when I was accepted into the School of Public Health, my concentration was environmental health. I did a ton of work with epidemiology, biostatistics, population health, communicable disease, maternal child health, toxicology. And obviously acute health is still a concern. And in doing so, going through the school there, again, you just are working with people that even today through the pandemic, I've got connections with just because I learned under them when they were a professor, and here they are directing many of our country's efforts through the pandemic. So it's pretty remarkable that it's come full circle like that. So in graduating there, like most new graduates do, whether it's graduate students or undergrads, you start looking for jobs. And again, during that time, it was right around the recession. I was applying for jobs in Baltimore, Maryland, where Hopkins is located. I'm a little bit of a homebody. I love New Jersey. I wanted to come back home, though. I love the Jersey Shore, of course, where my family spends some time. And so I kind of started applying everywhere, including locations in New Jersey. Now, at the time, when I wrapped up as a grad assistant, I also had the thought of, I love leadership. Maybe I'll start going to try to become a collegiate soccer coach. So I had some applications out there too. And I think a lot of it changed when I graduated from Hopkins and I started to get some comments back on my applications for some of these public health related jobs. There was a lot of interest in my background from Hopkins in the environmental health section. So I said, well, this sounds pretty desirable. I'll go this route. And I was very fortunate to get an email back from the Burlington County Health Department where I actually went to high school in Burlington County. And I started as an entry-level hazardous materials technician with the Burlington County Health Department back in 2007, 2008. And it was a great opportunity because, it was within my field. It was a great stepping stone to get in there. The health officer at the time kind of brought me under their wing, and I worked up through the ranks, took the health officer's examination, got my license. And after 7 years there, I started applying. Princeton had an opening. I was fortunate to get an interview, and Princeton was kind of looking to turn the leaf over with the health department and start to kind of change course a little bit. Princeton University had just gone through their meningitis situation. So there's a lot of things changing, a lot of new, exciting things, scary things, but exciting things. And I was fortunate enough to be selected as the health officer for Princeton. So now I've been here 7 years. I was in 2014, and it's been just exciting ever since.
That's great. Jeff Grosser, Princeton Health Officer. Thank you, Jeff. Appreciate your time.
Mayor. Thank you very much.
Thank you for joining us for the second episode of the Princeton Podcast. Special thanks to our podcast host, Mayor Mark Freda, and his guest, Jeff Grosser. The Princeton Podcast is produced as a community service by HG Media, providing audio, video, and website design services here in Princeton since 1999. If you enjoyed this episode of the Princeton Podcast, please share it with your friends and be sure to subscribe to our podcast on Apple Podcasts, Google, Stitcher, Spotify, or wherever you listen to podcasts.